Before proceeding to our today's topic of discussion, this channel is for information purpose only and cannot be used as a source for your personal health care. Hi, this is Numan. I am a pharmacist and welcome to our channel Know Your Medicine. Today we are going to discuss about azithromycin. Azithromycin is an antibiotic belonging to the class of macrolides. Macrolides are very broad spectrum and are most well tolerated antibiotics. Azithromycin works against a variety of bacterial infection, whether they are gram-positive bacteria or gram-negative. So without wasting your further time, let's talk about the uses of azithromycin. Azithromycin is most widely used against the respiratory tract infections. There are two kinds of respiratory infections, lower RTI and upper RTI. RTI referred to as a respiratory tract infection. Any infection of lungs is referred to as a lower respiratory tract infection. There are a number of diseases related to it, but the most common are pneumonia and bronchitis. So the question is, how can you recognize whether you are having an upper RTI or the lower RTI? There are a number of symptoms. If there is a low fever, headache, sore throat, your throat becomes scratchy, you feel difficulty in swallowing, feeling pain in your throat, having a dry cough without any sputum, that means you're having a mild symptoms of lower respiratory tract infection. If there is a chest pain, your heart rate is abruptly high, and you're having a severe cough with phlegm, you feel difficulty in breathing, these are the severe symptoms of lower respiratory tract infection. Let's talk about the upper respiratory tract infection. It is usually referred to as the common cold. It mostly affects your upper air passage. Upper air passage includes your larynx, pharynx and nasal passage. Larynx is a small cavity around your vocal cords. Pharynx is a cavity behind your nose and mouth. What are the symptoms of upper RTI? These include nasal congestion, excess mucus, sneezing, runny nose, itchy eyes, bad breath and loss of sense of smell. These two are the most common uses of azithromycin. Other uses include otitis media. Otitis media is an infection of middle ear. It occurs as a result of cold, sore throat, respiratory tract infection. It mostly occurs in children. The symptoms of otitis media include ear pain, loss of balance, hearing difficulties, and fever. It can also be used as a second-line treatment for typhoid fever. If your body becomes resistant to other antibiotics, then your choice of medicine will be azithromycin. Azithromycin is also used for skin and soft tissue infection, for acne, and it can also be used for sexually transmitted diseases in both men and women. If there is a urinary tract infection, then azithromycin is the perfect drug of choice. If we talk about the dosage of azithromycin comes in two forms, 250 mg and 500 mg, and in syrup form it comes with 200 mg per 5 ml dose. For respiratory tract infection and skin infection, the dosage is 500 mg once a day for 3 days. For sexually transmitted diseases, its dose should be 1 gram OD for 3 days, and for typhoid fever, 500 mg twice a day for 5 to 7 days. Obviously, every medicine has its side effects. If you are looking for the side effects of azithromycin, then you will be disappointed because it is the most well tolerated antibiotic. The less common side effects include abdominal pain, nausea, vomiting, and diarrhea. Although there is no detailed study, azithromycin can be used during pregnancy when there is no alternative is available. In patients with hepatic impairment, azithromycin is contraindicated. It can also not be used in patients who are allergic to azithromycin. If you have any query about this medicine or any other medicine, please do comment below, and do not forget to subscribe our channel and like this video.